And preliminary findings show Senator Graham died from an aortic dissection. One of the main symptoms is high blood pressure, which can come without obvious warning signs. Over time, the added force of blood against your arteries can weaken blood vessel walls. News Channel 6's Jartavius Edmonds spoke with two local doctors about the connection between blood pressure, the aorta, and an emergency that can quickly become deadly. Jartavius?
Brad, doctors I spoke with say this does not mean every person with high blood pressure will have an aortic dissection, but they do want people to understand what years of uncontrolled blood pressure can do to the blood vessels, and knowing your numbers matter before an emergency happens. With every beat, the heart pushes blood through the aorta. That means the walls of the body's largest artery are constantly handling pressure. The American Heart Association lists high blood pressure as a risk factor for aortic aneurysm and dissection.
Here's the aorta.
Because the increased force of blood can weaken artery walls over time.
But one of the most modifiable risk factors for aortic dissection is uncontrolled blood pressure. Now, it doesn't mean that everyone with high blood pressure, which is an extremely common cardiovascular disease, is at risk for aortic dissection, but it's one of the most common modifiable causes.
The concern starts along the inner surface of the blood vessel. That's the same area where a dissection begins, with a tear in the inner layer of the aorta.
And aortic dissection, as well as a lot of the other diseases that affect the heart and the aorta, are diseases of this inner lining of the blood vessels.
Once that tear develops, blood can move between the layers of the aortic wall, separating them as the dissection extends. The danger grows if the aorta ruptures.
If there's a rupture, that's a massive bleeding, and patients can become very, very unstable very quickly because their blood pressure goes down and then they internally bleed to death.
Doctors say warning signs can come on suddenly and include severe chest or back pain, loss of consciousness, stroke-like symptoms, and if someone becomes unresponsive, Dr. Johnson says the people around them need to move quickly.
In the moment, if someone passes out and is unresponsive, it's call 911, start CPR, and get an AED, an automatic external defibrillator.
Doctors say the goal isn't to wait until the body reaches that point. High blood pressure is one risk factor people can work with their health care provider to manage. And the first step is knowing where your numbers stand. The doctors I spoke with say this is about awareness, not assuming every chest pain is an aortic dissection, but also not brushing off sudden severe symptoms when something doesn't feel right. At 6, I'll show you the simple steps one doctor says everyone can take to start paying closer attention to their blood pressure. Jenny?
All right, thank you, Jartavia.